When the new chief minister of Kerala was sworn in, he grounded his administration in a specific philosophical premise that the true measure of a civilized society is determined by how it treats its most vulnerable populations. That ideology is immediately tested by the logistics of healthcare. For low-income residents, citing the financial and physical strain of the bus journey as the primary factor in his decision to give up. When travel expenses are high enough to force a patient to abandon their recovery, the transit system becomes a gatekeeper to medical care, a situation the state views as a denial of a fundamental human right. To bridge this gap, the state mandated a series of sweeping subsidies. They granted free or deeply discounted travel to targeted groups: cancer patients traveling for chemotherapy, the elderly over 70, students, and persons with disabilities. The policy then expanded to include its most significant mandate, the promise of completely free public transit for all women, moving the subsidy from a targeted safety net to a demographic comprising half the total population. The agency tasked with delivering this mandate is Ksrtc. However, this rollout is happening while the corporation is facing a severe pre-existing financial crisis. Ksrtc has recently relied on bank overdrafts just to cover employee salaries and pensions. The agency is now expected to give away its primary service for free, while its own financial reserves are already depleted. This creates a direct operational conflict. The state must figure out how a bankrupt agency can realistically deliver these welfare promises without triggering a total collapse of the transit system. From a passenger's perspective, eliminating transit costs generates an immediate social return on investment. Removing the cost of a ticket allows low-income women to accept domestic or service jobs further from their homes. When the commute is free, they can travel to higher-paying areas without seeing their daily wages eroded by travel expenses. Similarly, for those patients in long-term medical care, free transport ensures strict adherence to chemotherapy and radiation schedules, preventing the distance fatigue that often leads to patients defaulting on their treatment. In this context, free transit acts as a measurable catalyst for both economic mobility and health equity, bridging the gap between a patient's home and the hospital gate. However, looking at the network through the eyes of a transport planner reveals a different challenge. Zero-cost tickets often trigger induced demand, where a surge in non-essential trips severely overloads critical high-traffic arteries like MG Road, where hundreds of buses already struggle with daily congestion. The financial ledger shows the disparity. Targeted subsidies for the sick and elderly are manageable, but a universal subsidy for all women creates a compounding deficit for every kilometer driven. Funding this actively diverts capital away from fleet upgrades and urgent infrastructure repairs. This leaves planners with a dilemma, balancing societal empowerment against the mathematical reality of operational bankruptcy. To manage this financial bleed, the state is moving away from untraceable paper passes and toward a measurable digital system. They have implemented gender ticketing, a tracking mechanism designed to capture precise data on exactly how many female riders are using the network and on which specific routes. The next step is the rollout of RFID-embedded smart cards. These allow the agency to track individual usage, verify eligibility, and transmit exact usage metrics into a centralized database. By using all this data, the state can convert a broad welfare giveaway into a calculated economic lever, ensuring that subsidies are allocated exactly where they are needed most. It is important to deconstruct the idea of free transit. The cost of operating a bus remains constant whether a passenger pays or not. The financial burden doesn't disappear, it simply shifts from the individual passenger to the broader taxpayer base. Expecting a public transit agency to function as a welfare tool changes its operational logic. It can no longer be judged as a profit-making enterprise when its primary mandate is to lose money for the sake of the public good. True welfare is an intentional, planned financial loss that a society agrees to absorb collectively rather than a business model to be optimized. Kerala's approach is a real-time experiment for any city attempting to merge mass transit with social equity. It shows that removing the fare is only the initial, easiest step in a much more complex process. To be sustainable, these programs require meticulously managed data and technology to prevent the system from collapsing under the weight of the demand it creates. Concluding this experiment requires both the empathy to design a safety net and the financial discipline to ensure the bus is actually there to catch those who need it.